We know for the treatment of acne, we are going to do facials, right? The ultimate goal here is to really cleanse the skin, clear the follicles to prevent any future breakouts, heal any existing lesions, stop new ones from happening, prevent the scarring, and certainly minimize the psychological stress and embarrassment that comes along with acne. And we know that acne facials can produce some really remarkable results on the skin. And you can feel it from the beginning of the facial to the end of the facial, how different the skin feels and how different it looks. It really is remarkable what we can do. Typically, you want to do facials about every 2 weeks until clearing starts to happen on the skin. It may take 4 to 8 weeks to show improvement. It may take longer depending on how severe the acne is and depending on how long the acne has gone untreated. Facials every 2 weeks certainly help to keep the follicle clear and to keep the oil and acne under control. Once you start to see a clearing, you can start to stretch the facials to every 3 weeks. I would not go more than every 4 weeks. You need to keep maintaining the state of your skin. If this is a menstruation-induced acne, absolutely every 4 weeks. Again, about a week prior to the period, to your period, so that we can clear the skin of that bacteria so you don't see those breakouts as much. We want to make sure that we're focusing on calming the inflammations. We want to make sure that we're doing proper extractions. They must be done gently. We know we can't extract any nodules or cysts. Typically, your extraction should not last more than 10 to 15 minutes in your facial. Anything more than that is it's just too much for people to handle. And you don't want to discourage people from coming back and getting another facial because you've just kind of dug into their skin for way too long. We want to make sure that we're always wearing gloves, and especially for clients that are coming to us for the first time, you want to make sure you're working on them gently. You know, you don't want them leaving saying, oh my God, that was the worst thing I ever went through. It was so painful. I'm never getting that done again. You know, you want to explain to them before the facial starts what they can expect during the treatment and after the treatment. I always let my clients know if I'm ever working on you and you're feeling uncomfortable, if you want me to stop doing extractions, if you need a break, if you want me to move to another area, please don't feel bad telling me. I mean, this is how I start all of my treatments. And if it's someone that I'm doing a lot of extractions on, I'll ask them several times while I'm doing the extractions, are you okay? Do you want me to stop? Are you okay? You know, and I make sure that they're doing okay, because a lot of times people are scared to speak up. But by the end of the facial, you should feel much smoother skin. Typically, for every year of acne, it takes about 3 months of treatment to clear the acne. So that's kind of like a rough guideline that you can tell your clients how they can expect to see the clearing. But keep in mind, they have to do the right things at home. They need to eat right. They need to drink right. They need to make sure that they're doing the proper skincare regimen at home. If the acne is not bad, it can subside on its own with minimum treatment. Superficial acne responds very, very well to seaweed, to topical benzoyl peroxide, antibiotics, tretinoin, vitamin A, things like that. Deeper acne certainly requires oral antibiotics. We can start getting to the AHAs and the BHAs at this point. A lot of this can help, and you really start to see some really, really great improvements on the skin. Accutane, or isotretinoin, we know is a vitamin A derivative. We know Accutane is taken off the market at this point because it's a really severe drug, okay? We know it's very effective. It helps to reduce the size of the oil glands by about 35 to 58%. It reduces the amount of oil produced by about 80%. So it really is very effective. However, there is a lot of side effects that we have to be aware of, okay? We can never use it without a doctor's advice. It is the #1 prescribed teratogenic medication in the United States. What that means is it's the #1 prescribed medication that causes birth defects. So you are required to use 2 forms of birth control when you're using Accutane. You do actually have to sign a waiver with your doctor saying that you will. We know it can cause dry lips, dry skin, dry eyes. It can cause joint pain. It can cause depression. It can cause suicide. The list of side effects is endless with this medication. So you really, really do need to be under a very close watch by a doctor. High frequency is also a really great treatment option. We also know this as sparking. This is where we use the glass electrode and a UVC germicidal ray to spark the skin, and it provides a very germicidal activity on the skin. It promotes healing. It's anti-inflammatory. It basically forces oxygen into the skin, and we know bacteria can't grow in oxygen. So if we're forcing oxygen into the skin, it will help to kill that bacteria. We need to make sure that we're not using this on people that are pregnant, high blood pressure, heart conditions, epilepsy, asthma, braces, metal implants, heavy dental work, things like that. But, we can also start to combine different treatments to really get some nice effects. This may be a lifelong battle. We need to, again, keep that in our clients' minds and explain to them that, once this is cleared, you just need to constantly keep up with your treatments. If topical treatments don't work, doctors may prescribe oral contraceptives. Okay, I mentioned earlier that there are some that have been FDA approved to help treat acne because they get the hormones under control. There are, again, also possible side effects with oral contraceptives, so talk to your doctor about that. You can also be prescribed something that's called an androgen receptor blocker. Okay, remember how acne is formed. The androgen hormones are the male hormones that increase your sebum production. If we put blockers in that prevent the cells of the body from interacting with those androgens, less androgens typically mean less acne. But again, there can be side effects, so just be careful with this as well. Common sense care, we know. Keep your face and your hair clean, right? The power of prevention. We want to make sure we're not scrubbing our face excessively. We want to make sure that we're being gentle. Cleanse before your workout. Most people cleanse their face after they work out, but if we're sweating and we're wiping our face with a towel, all the dirt and the oil and the bacteria and the makeup is pushed right into the pores. So cleanse and tone before you work out to make sure that your skin is clean so that when you start to sweat when you're working out, if you're wiping your face with a towel, now it's just sweat that you're wiping. Okay, and sweat itself does not cause breakouts. So, keep this in mind. Cleanse your face before you're working out. Obviously, cleanse it afterwards as well. Use water-based products, not oil-based. You can also try things like mineral cosmetics, seem to work really, really well. Absolutely remove your makeup before you go to bed. Leaving the makeup on overnight can absolutely clog your pores. You want to make sure that you throw out old makeup. You want to make sure you clean your brushes every week. Don't pick or squeeze your blemishes. We know that this can cause the infection to go deeper and spread quicker and cause scarring as well. Don't wear tight elasticized headbands, turtlenecks, or other tight-fitting apparel. If it's too tight, you can actually trap the sebum. So we don't want to do that either. Limit your sun exposure. We kind of talked about this earlier, but about 15 minutes 3 to 4 times a week is beneficial. It is antibacterial. It can help clear up blemishes if there's not too much sun exposure. If it's too much, we talked earlier about what can happen and about how the sun can actually damage the cells and make everything worse. So just make sure that you are keeping all of this in perspective. Proper exfoliation of acne, we know that regular exfoliation does help to keep the pores clean. It is very, very important that we are exfoliating the skin, but that we're doing it properly. We don't want to use something that's too abrasive that can irritate the skin or that can cause any of these infections to spread. Things like an enzymatic exfoliation are really great for ultra-sensitive clients or clients that have acne or clients that are using things like Retin-A, because these peels help to dissolve the keratinized epidermal cells. They can help to dislodge sebaceous filaments. It can prepare the skin for extractions. It helps to eliminate flaking and superficial peeling from other products possibly that they were using so that those dead skin cells don't fall into the pores as well. Enzymes that are derived from papaya or pineapple are ideal because they help to dissolve the dead skin cells with the least chance of irritation. We certainly don't want to irritate acneic skin any more than it already is. Chemical exfoliation uses acids to remove debris from the surface of the skin and deepen the pores, so they are very effective also. Things like beta-hydroxy acids or salicylic acid or alpha-hydroxy acid, which is a glycolic acid. These are ideal for acne because they help to loosen the bonds that hold those dead skin cells together, which can, again, avoid the pores from getting clogged. Home care is essential. It is essential for keeping your acne under control. I tell my clients all the time, we never want to feel like a pushy salesman when we're retailing to our clients, but what's really important to understand is even if your clients are coming to you twice a month for a facial like they're supposed to if they have acne, that means that you, as a professional, are cleansing their face 24 times a year. Your clients, however, when they go home and they wash their face morning and night like they're supposed to, they are washing their face 704 times a year. So do you think it's important that they have the proper home care regimen? Absolutely. This is really where so much of their success with acne is coming from, making sure that they're using the proper home care. It does require commitment from the client. They do have to be persistent and on top of washing their face every morning and night. It should include a cleanser, a toner, an exfoliant, a serum, a mask, and a moisturizer. However, you know your clients, and if you know that your clients are only going to use 2 products, then just give them 2 products. The last thing you want to do is say, here's a list of 10 things you have to do 2 times a day, and your client goes, what, are you crazy? There's no way I'm going to do that. They might buy the products and then go home and go, there's no way I'm doing this, and they're just not going to use any of it. So know your clients, know what's realistic for them, and then give them something that will fit that. It may also require changes in diet and lifestyle, and these are just things, again, we're not prescribing, we're not diagnosing, but explain to your clients different things that you know that can help their acne condition, and we'll get into more of those as we go along as well. It's also important that we maintain the proper balance of pH in the skin. Okay, pH imbalance can cause acne, it can cause dryness, and it can cause further irritation. We know that the pH level is very, very important because we have the acid mantle on our skin, or that thin protective layering that protects our skin. When that's out of balance, we can certainly see acne getting flared up. So we need to make sure that we're using, number one, the proper cleanser. We need to stick with a mild one. If it's burning, if it's stinging, it's probably too acidic. We need to make sure that we're adding back in any lost moisture. When the skin produces less oil, the acid mantle is affected. We need heavier moisturizer to help recreate that barrier. We need to drink a lot of water. We need to limit the skin's exposure to the sun as well. We talked about that also. For men, they need to make sure that they are shaving properly. We know that shaving can worsen acne, or we might see breakouts because of improper shaving. So we want to make sure that we're softening the hairs before shaving. And you can walk through the mall and they have some really, really great stores, like high-end stores for men's shaving products. But there really is an art to shaving. That's one of the stores is called The Art of Shaving. And men spend big, big money on the proper products to use to really get a nice clean shave without having those breakouts. So you can soften the hairs by wetting the face with lukewarm water before you shave. It's important that you use a lather from a gentle cleanser is a great idea. Something like a gentle cleansing milk is great because it has really great slip, and it also has very calming, soothing benefits to it. Experiment. You might find that a manual razor works better than an electric razor or vice versa. Find out what works best for you. Also make sure that the blade on the razor is sharp so that it prevents nicks, which can further irritate the skin and lead to more breakouts. You want to make sure that you shave lightly also. Okay, you want to, again, prevent the nicks. You want to prevent nicking any current acne that you have. You also want to make sure that you're not shaving off your acne, all right? Again, we don't want to make things worse. We want things to be able to heal properly. You also want to make sure that you're changing and cleaning your razor frequently because razors harbor a ton of bacteria and obviously dead skin cells. And I remember years ago I was watching an Oprah Winfrey show and they were going through people's bathrooms to see how much bacteria was on different things. And they had a woman in there who hadn't bought a new razor in like 10 years. and it was just, when they showed it under the light and they showed how much bacteria and dead skin cells were in there, it was so disgusting. I mean, it was just, you know, after you see something like that, you're throwing out your razor every week. But it can absolutely cause more breakouts, especially if you're nicking your skin and all that bacteria from the razor goes into there. Obviously, this is not a good thing if we have acne, or even if we don't. But men skincare in particular, keep it simple, okay? Refer to their facials as skin treatments. A lot of times they don't like to say they're coming in for a facial, but if we say they're coming in for a skin treatment, you know, it's just different wording that we can put out there for men or on our menus to make them more accepting of getting these treatments done. What if your skin is oily and dry? Okay, this does happen. Most people with the skin are using a cleanser that strips the skin because they're trying to dry out the oil. This leaves dry areas. If you already have some dry areas, it can leave those dry areas even drier, even flakier. And then what they try to do is to apply a real heavy moisturizer to help with the dryness, which ends up training the skin to make less oil there. And it becomes, again, another vicious cycle. So if you have oily and dry skin, it's important that you exfoliate several times a week. If oily skin is not properly exfoliated, the dead skin cells or those dry patches can clog the pores. So you want to exfoliate and moisturize with products that are suited for your skin type, and it's important that we get it under balance. Some alternative treatments that you can do. Tea tree oil is great. You can use this 3 times a day. Dab a drop on the blemishes. It does discourage infection and speed the healing. Interestingly enough, research shows that 5% of tea tree oil is as effective against acne as 5% benzoyl peroxide solution, but without the excessive drying. Okay, very interesting numbers here. Tea tree may take longer to work, and but it's just as effective. Also, things like chasteberry tea you can use for monthly flare-ups. Drink 1 to 2 cups a day to help regulate your hormones. This, again, might take a couple months to work, and you don't want to drink more than 1 to 2 cups a day. Also, things like vinegar and lemon juice, you can dab this directly on the blemishes because they contain acids that can help to flush the pores. You can also do old folk remedies, right? Nutmeg and honey. Take 1 teaspoon of powdered nutmeg, 1 teaspoon of honey, mix it together, apply it, and leave it on a blemish for about 20 minutes, and then wash it off. It has very antiseptic properties to it. Things like aloe vera. Studies show that 90% of skin sores completely healed within 5 days of applying. So we know aloe vera is very soothing and very healing to the skin. Zinc supplements. Some acne sufferers have very low levels of zinc. So if we are taking zinc supplements, talk to your doctor first. But it can show visible improvements in about 1/3 of the users because it helps to heal wounds faster. It helps to reduce inflammation. We can also add it to creams and lotions and things like that and use it that way as well. As far as vitamin and mineral therapy, things like vitamins A, C, D, and E are important. Vitamin A helps to support the overall health of our skin. It aids in functioning and the repair of dead skin cells. Vitamin C is needed to repair the skin and the tissues and just to support the healing processes of the body. Vitamin D, a lot of people are very low on vitamin D these days, right? Cells with low vitamin D create more of an inflammatory response than those that are compared to adequate levels of vitamin D. And vitamin E, we know, is very healing. It helps to heal any damage, both internally and externally. Zinc, selenium, beta-carotene, vitamin B complex. If breakouts are due to a monthly cycle, vitamin B6 can help. Chlorophyll is a great anti-inflammatory. Pancreatin is also very helpful. Oh, wrong way. Probiotics are also really great. Okay, you can get probiotics a couple of different ways. You can eat them. You can take them in a pill form. Again, talk to your doctor. But ingested probiotics rebalance the bacteria in the stomach to create an abundance of good bacteria. Good bacteria releases oxygen. We know what oxygen does, right? We know bacteria cannot live in the presence of oxygen. But oxygen also helps the skin to breathe better. It helps the blood to flow. And the balance is then restored. If we're applying probiotics topically, They help to protect against harmful bacteria, build up the skin's protective barrier, and again, restore the balance. We know that with acne, we cannot do any type of effleurage massage on the face, right? We certainly don't want to be spreading any bacteria. So things like shiatsu, where we're talking more about acupressure, can be very, very beneficial and extremely relaxing. Shiatsu works on Chinese philosophies where we're talking about meridians or different energy zones that are running through the body, and they believe very strongly that anything along that meridian, if there's a blockage or an imbalance, anything along that meridian will be affected. So there are certain pressure points that we can work on to help release or open these blockages and allow the qi or the body's energy and the body's circulation to flow better, so that we're seeing more healthy conditions in those areas. So when we're dealing with acne, there's different points on the forearms, the hands, the face, base of skull, upper chest, sides of the spinal cord, and in the legs that we can work on. And when we work on these points, it can cause an increase in circulation, relieve muscle tension, adjust hormonal imbalances, and boost the immune system. The stomach meridian is the meridian that governs the skin functions. And you can Google any of this. I mean, there's so many different shiatsu maps that you can find. But when you look at where the stomach meridian runs, you'll have a better idea of where the different points are. We also know from our root cause classes, we know all about face mapping. And this, again, goes along with those Chinese philosophies of the meridians running through the body and that everything is connected. So we know when we're seeing breakouts on the face, it can be a direct correlation of what's going on inside of the body. And we've talked about this in our root cause class, but if we're seeing breakouts in the forehead, it can reflect some type of imbalance or blockage in the small intestines. And it doesn't mean your small intestines is not functioning properly. It just might mean that maybe you need to eat slower so that you properly digest your food. Okay? It could be something that simple. It could be that you're wearing a hat and the friction is causing it. But if we're looking at the root cause of these breakouts, and we know cures always goes back to that root cause, then we might want to suggest to our clients not to rush through the meals. Maybe we want to use smaller utensils or chopsticks, or we might want to eat with the opposite hand, something that's going to force us to eat slower. You know, we live in a very fast-paced, stressful environment. A lot of times at work, we don't even take a lunch. We're eating at our desk as we're rushing through 10 other things, or we're eating in the car as we're driving our kids to their games. And, you know, we're not eating the right foods, nor are we eating properly. We're not taking small bites. We're not chewing properly. We're eating large amounts of things. Typically, if we can start to break that habit and eat slower, we will consume about 70% less calories per meal, which is another hidden benefit, right? If we're seeing breakouts between the eyes, this can reflect some type of imbalance with the liver, meaning that maybe we're taking in too many toxins every day. Maybe we need to reduce those toxins that we consume on a daily basis. Maybe we need to cut down on the processed prepackaged food. Maybe we need to start eating more organic food. Maybe we can do something like drink a glass of water every day mixed with a tablespoon of organic apple cider vinegar or lemon juice to help cleanse the body. We can start to eat more dark leafy vegetables to help rid the body of these toxins. If we're seeing breakouts on the side of the nose, it can reflect something with the stomach. So maybe we just need to eat cleaner. Maybe we need to skip any added sugars. Maybe we need to stay away from the white food, right? Avoid saturated or trans fats. Maybe we need to increase our lean proteins. These are all things that we can think about. If we're seeing breakouts in the chin area, typically we think of this as a hormonal thing, right? But don't just think of what's happening from our endocrine system or the system that regulates those hormones. But again, you know, think outside of that and think about all of the foods that we're taking in that might be containing hormones as well, and we might be able to make some type of adjustments there as well. Also note where the location of the breakout is. It may be found in an area where underneath maybe there's metal inside the mouth, maybe there's a rotten tooth or a bad filling, maybe there's inflamed wisdom tooth or inflamed gums, or maybe some sinus issues. Pay attention to where those breakouts are and see what's happening underneath the skin. There might be a direct correlation there as well, something to talk to your clients about also. Yin and yang, again, this is just, these are just different things for you to think about. I don't want you guys to think you have to be fluent in Chinese medicine, but these are just different concepts and philosophies to just think about. And if they strike something with you, maybe you want to read up a little bit more on them. I can certainly give you more information myself. But yin and yang is very interesting. And this philosophy strongly believes that if you have acne, and we know most blemishes appear on the upper body, right? We know most of them appear either on the face or the shoulders or the back or the chest. Typically, that's where you're seeing your breakouts. Blemishes are a yin phenomenon. Yin things expand and they rise. Sugar and fat are yin. They cause things to expand and grow. So the philosophy is maybe you need to cut back on your sugars, your fatty foods, your fast foods, your foods that are rich in fat and salt. These are things to think about. When you exceed what your body needs, it's either stored or it's eliminated. And we know that it can be eliminated through the skin. So if this is the case, it's recommended to eat more alkaline food. Chew your food well. Increase your exercise to increase your circulation and your metabolism. Avoid the excess sugars and fats and oils.